Hi there, thanks for tuning in and welcome to JH Backcountry Health. My name is Ian, I'm a certified personal trainer, and today I'll be helping Dr. Laura go through some considerations for exercising while pregnant. Substantial research has shown that exercise during pregnancy can have significant health benefits for both the mother and the developing fetus, as long as appropriate modifications and precautions are taken.
Hey guys, I just wanted to talk a little bit about strength training and why it is so awesome to do during pregnancy. I strength trained, I'd say, second and third trimester of my last pregnancy. I was not someone who was able to do very much at all my first trimester of pregnancy either time. And that's okay. If you're feeling bad first trimester, you don't need to push it. Second and third trimester, I really enjoyed strength training. And here's why. Like I said in the other video, you have a lot of relaxin in your system, stretching out your joints. Your muscles are working really hard to hold everything together. Having stronger muscles and having better patterns, it held everything together a lot better. I didn't have a lot of low back pain during pregnancy. I didn't have a lot of thoracic pain during pregnancy because all of those muscles were strong and they could support my body during that time. If you think about labor as well, everybody compares it to a marathon. Like, it's exhausting, it's heavy manual labor. People are exhausted afterwards, and being a little bit stronger going in is going to help. Exercise in general, it helps you feel better. It can help with prenatal depression, just getting more blood flow in the body, getting those good hormones that you get from exercise can make a big difference.
If you are pregnant and considering participating in an exercise program, please be sure to consult with your doctor beforehand and talk through any potential contraindications to exercise. These are including but not limited to persistent bleeding during the second or third trimester, preterm labor during a current or prior pregnancy, or pregnancy-induced hypertension, meaning high blood pressure. If you are healthy and medically cleared for exercise, that's great. Here are some general considerations to keep in mind. So, if you're someone who already exercises regularly and has experience in the gym, you can go ahead and continue with moderate levels of exercise. This is especially true if you're working with a personal trainer or a coach who knows how to make the appropriate modifications to specific exercises for pregnant women. In general, it's recommended that as you go into the third trimester, you reduce levels of intensity and exercise activity. If you're new to exercise, consider starting with 15 minutes per day of continuous aerobic activity. Great things to try could be treadmill walking, stationary cycling, swimming, or other activities like that. From there, you can go ahead and progress to up to 30 minutes per day, 3 to 5 days per week of continuous aerobic activity. As far as resistance training goes, this can be done 2 to 3 days a week, 1 to 3 sets of 12 to 15 repetitions per exercise. This is a conservative recommendation for those who are newer to exercise, and make sure to focus on your breathing control while you're exercising and also taking appropriate rest in between sets. Again, if you're an experienced exerciser, you can stick with moderate to high intensity activity through the first trimester. Lower intensity resistance training programs are recommended for the second and third trimesters. You may also want to consider avoiding plyometrics or jumping exercises after the first trimester. With that all said, how you feel and what you can tolerate during the various stages of pregnancy will vary from person to person. As you progress into the more advanced stages of pregnancy in the second and third trimesters, keep in mind that your posture while you're exercising can affect blood flow to the uterus. You'll generally want to avoid prone or supine positions, meaning lying on your back or lying on your stomach while exercising. And you'll also want to avoid uncontrolled or aggressive twisting motions of the torso. Another thing to look out for is certain resistance exercises like those hip abduction and adduction machines that you see in the gym. In general, seated or standing positions for exercise are advised, including for flexibility exercise like static or active stretching.
Let's talk about diastasis or diastasis recti. So that is when your stomach splits a little bit, and it can be, small, half an inch, up to, like in twin pregnancies, 5 inches. Your abs are separating right at the linea alba, down the middle of the stomach. Not quite sure. Studies kind of go both ways, but exercise may contribute. And so being really thoughtful about how you exercise and how you do, especially ab work. And so working with a trainer, or there's some amazing pelvic floor PTs in town. You want to make sure if you're doing any kind of ab exercise that you don't see any coning or doming in the abs, and that's where the abs kind of come up to a peak. That means you're putting a lot of pressure into the abs. When you're doing squats, for example, not doing the heavy core bracing, the Valsalva maneuver, where you take a breath in, hold it, go down, come up, because that's basically, it's loading the system. That's pushing down into your pelvic floor, which is already getting a lot of pressure from the uterus and pushing out into your abs. But instead, doing probably less weight, breathing in and breathing out during your exercise. And as you breathe out, focus on zippering your abs together. This is something that I would definitely, if you don't have experience, work with a trainer who knows about working with pregnancy and is comfortable with that. Again, there's amazing pelvic floor PTs in town that I can recommend that you could see as well.
Another thing to keep in mind is that changes to your cardiovascular system during pregnancy may decrease your work capacity and the oxygen available for aerobic exercise. Proper hydration also will be extra important when exercising while pregnant. And even when you're not exercising, pregnancy can increase the metabolic demands on your body by up to 300 calories per day. So if you are going to exercise while you're pregnant, you'll want to be sure to take in adequate calories immediately following that exercise session. Another important safety concern to remember is that pregnant women can be susceptible to nausea, dizziness, and fainting. If you experience any of these symptoms, as well as abdominal pain or contractions, excessive shortness of breath, bleeding, or leakage of amniotic fluid while exercising, make sure to stop exercising right away and consult your doctor. Finally, in the postpartum period, there can be an understandable desire to get back to the exercise program quickly and return to previous fitness and body composition. Just keep in mind that any physical and physiological changes that occur in the body during pregnancy can last for up to 4 to 6 weeks after childbirth. The ideal protocol for postnatal women is to refocus on proper posture and alignment, joint stability, motor skills, as well as activation of the deep core musculature, including the transverse abdominis, internal obliques, and pelvic floor. A return to a more intense exercise program should be executed gradually. Again, please be sure to reach out to your doctor with any questions or concerns regarding exercising during pregnancy. We hope that these tips are helpful for you to stay fit and active before, during, and after becoming a mom. Thanks for watching.